My name is Hunter Boggs. I am an associate professor in radiation oncology. I've been in practice for about 7 years. I'm primarily based in Birmingham at UAB, and I've been fortunate to be able to come down over to Anniston and deliver treatment here since July of last year. It might be helpful to understand how head and neck is divided as an oncologist sees it. And so you have your oral cavity, which is your mouth. The back part of your mouth is your oropharynx. Up above that, back behind your nose, is your nasopharynx. And down here are different parts of your pharynx and your larynx. So most cancers now, in the current era, actually come from within the oropharynx. And we're starting to see a dramatic rise in the amount of oropharyngeal cancers. We will still see a good bit of oral cavity cancers. And then we'll also see cancers down in the voice box, or what we call the glottic larynx, is another common type of cancer in the head and neck. So traditionally, smoking and alcohol were very large contributors to the development of head and neck cancer. What we found probably within the last 10 to 15 years is that we have had a rise in what we call HPV-associated head and neck cancers. These are cancers that are mostly associated with the oropharynx, which is the tonsils, the uvula, the very back part of the tongue. So HPV, you may have heard associated with cervical cancer. It is an STD, and it's something that is very common, but most of the time our body clears it. In a certain amount of patients, there can be a retaining of the HPV, and 10, 15, 20 years later, that can develop primarily in men into oropharyngeal cancer. Now, the good news is that HPV-associated cancers of the head and neck actually have a very good prognosis, and we're looking at ways to not have to treat as intensely and still get the same outcomes. So for head and neck cancer, if you have a fullness in your mouth, something that didn't feel like it was there before, I've heard it described as a popcorn kernel. It's something that's new, maybe back in the back of your throat. New ear pain, new trouble swallowing, new unexplained weight loss. Oftentimes with cancers of the nasal cavity or nasopharynx, you've got all of a sudden new nasal bleeding or nasal blockage that you didn't have before. Hoarseness is very common, particularly for cancers of the voice box. And actually, these cancers often will end up in lymph nodes on your neck. So sometimes it is a big mass on the side of the neck that you don't know why it's there, and it's painless. That's a common reason also that a common way that these can develop. Yeah, that's a really good question. So the esophagus is a tube that essentially runs from your throat, just below your larynx, all the way down to your stomach. So the upper parts of your esophagus are what we call the cervical esophagus. Those are that actually can be considered somewhat of a form of head and neck cancer. Most esophageal cancers actually don't arise within that part of the esophagus. Most of them come from within the middle to lower parts of the esophagus. The middle part of the esophagus, a lot of times smoking and alcohol use can increase the risk of that. And actually what we're really seeing in the modern era at the lower part of the esophagus near the stomach is patients who have long-standing gastric reflux can increase your risk for having esophageal cancer of that part of the esophagus. I think it's never too early, if you have something that's going on that is worrying you, to come in to see a doctor. In general, the earlier a cancer is diagnosed, the better your treatment options are going to be, the better your prognosis is going to be, and potentially the less invasive treatments you will need. And so if you have something that is worrisome to you, it's always best to start with your primary care doctor and have them check it out, and then we can escalate that to other physicians as needed. So both for head and neck and for esophageal cancer, radiation is a very important part of the treatment. For head and neck cancers, then you can either have radiation after surgery or you can have it instead of surgery. Oftentimes, radiation is done alongside chemotherapy. In esophageal cancer, oftentimes radiation and chemotherapy are either done together by themselves, or you can do them before you do surgery. So typically how this would go is you go see your primary care doctor if you have a new symptom, and then if you have this new symptom that is worrisome, they'll send you to the appropriate physician. So if it's something that's more concerning up in the head and neck area, then you may go to an ENT. If it's further down in the esophagus, you may go to a GI doctor. And that's going to be who works you up for that. And then radiation would actually come in a good bit later in the care. So they would send you to us once that diagnosis is established, and then we would go through what our plan of care would be. So the way radiation is delivered, typically for these types of cancers of the head and neck and the esophagus, is you get a little bit of dose each day over anywhere from 4, 5, 6, or maybe even 7 weeks. So it's usually about 30 minutes of treatment a day. First thing we'll do is we scan you, and we mark you up, and we put you in the exact position how we're going to treat you. And then we do some planning while you go home, and then you come back in, and when you get the treatments, it's a machine that comes around you, almost like an x-ray machine. It doesn't cover you up, and you don't know anything is happening. And each treatment is about 30 minutes. First week you don't notice much, but then as the weeks go on, you can start to get irritation in the areas where we're treating. So for head and neck particularly, you can have some taste changes, some sore throat, and it can be difficult and sometimes unpleasant to get food down. So we really harp on appropriate nutrition for you. And if you really have a lot of trouble eating, then we may talk about other forms of getting you nutrition, such as a tube. And for the esophageal cancer patients, it's fairly similar, although the further down it goes, you have less problems with your mouth, with your taste, and it's more irritation when you swallow. And again, we really harp on making sure that you get appropriate nutrition for that. On a personal note, I have had 2 family members that have undergone radiation treatment for head and neck cancer. One was my father-in-law, and then another one was my father, and he was actually treated right at the beginning of the pandemic in 2020. It was a journey for both of them, and they, by the grace of God, are doing very well. They're both cured from their disease, and they're both really doing great and swallowing great and have great voice quality. But what I would tell you is the most important thing is if you have to start on this path, stick with it. And we're going to be your cheerleaders as a physicians, but don't stop. And let us help you. If you need things for pain management control, you let us know. We're here to be on your side with this fight.